Okay. Good evening and namaskar. The first 1,000 days is a period of rapid physical growth and accelerated mental development, offering a unique opportunity to build lifelong health and intelligence as the baby in the womb is dependent on the mother for nutrition as well as mental, physical, and emotional growth. The treatment and the nutrition of patients in the first 1,000 days makes a difference to the rest of the mother's and baby's life. So I, Ms. Sheetal Bandgar, on behalf of Mayor Vita Biotics, am pleased to welcome and thank all the delegates who have registered and are attending this webinar with us today. So, Mayor Vita Biotics is a global business partner of Vita Biotics UK, which is headquartered in London, which is UK's number one and world's fastest growing nutraceutical company. Dr. Kartar Singh Lalwani is the founder and chairman of Vita Biotics. He is a bioscience inventor who has successfully commercialized his own inventions. Here, Vitabiotics is one of the leading pharmaceutical manufacturers in India. It has created its unique portfolio of products for addressing the unmet needs of mothers during pregnancy and lactation and nutrition in growing children. So, the first 1,000 days refers to the period that begins with pregnancy planning and goes up to when the child reaches his or her second birthday. Each day of this journey is special and influences the way a mother and a child nutrition's developments and growths. This session will guide all of the doctors about ensuring that every child and every mother must have access to information to create an optimal environment during the first 1,000 days for a better tomorrow. For this, Mayor offers a unique portfolio of Calcimax 500, Calcimax Total, Calcimax P suspension, along with Well Woman as entirely a different range for women of all ages. So today, Mayor Vitabiotics provides a unique platform to connect, engage, and create an avenue towards the robust exchange of information on the topic of first 1,000 days under the topic named as the effect of perinatal nutrition on cognitive development and bone development under the guidance of leading and eminent speaker for today, Dr. Kiran Kohlo and Dr. Ravindra Chittal. So, talking about Dr. Kiran, she's a head of department at Leelavati Hospital and Research Center, Mumbai since 1996. She's an honorary consultant at Hinduja Healthcare Surgical, Khar, and Holy Family Hospital. She has practiced minimally invasive surgery since 1994 and has trained more than 5,000 gynaes in gynae endoscopy. She has been felicitated by the Guinness Book of World Records for being a part of world's largest health talk on breast cancer awareness in the year 2020. Thank you, Dr. Kiran, for joining us and congratulations.
Thank you.
Talking about Dr. Ravindra Chittal, he's been practicing as a consultant pediatrician and neonatologist since 1983. Attached as a consultant pediatrician at Leelavati Hospital and Research Center, Bandra West, Guru Nanak Hospital and Research Center, Bandra East, and Hinduja Healthcare, Khar West. He publishes articles in national journals on faculty and chaired sessions at local, national, and international conferences. And his special areas of interest are neonatology, pediatric intensive care, and pediatric rheumatology. Thank you, Dr. Ravindra, for joining us and congratulations. So today, both the doctors are going to interact with us and we are going to have a healthy panel discussion on the concept of first 1,000 days, that is from the fetal life to the childhood. Now, I would like to hand over the session to our dynamic speakers for the day. We'll start off with Dr. Kiran. Ma'am, the forum is all yours.
Yeah, sure. Thank you so much, Sheetal, for that wonderful introduction.
Thank you, ma'am.
Let me just share my screen. I must thank Maya Organics for this very, very unique program to bring awareness of the first 1,000 days of maternal infant nutrition, so important as they are the building blocks to the future. The hospitals I work in. Now we know that the first 1,000 days are between a woman's pregnancy, 270 days, and then up to the second birthday. During this period, there is a crucial window of opportunity to give a lifelong impact for the physical, cognitive, academic learning at school, and economic productivity. So therefore, it's a window of opportunity for not only long-term survival, growth, and development. The World Health Organization has put out the statement as late as 13th October 2020 to say severe malnutrition during the COVID-19 pandemic is been the most devastating side effect. Now, why 5,000 days? We feel that the 1,000 days between a woman's pregnancy and the child's second birthday offers a unique window of opportunity to build a healthier individual and more prosperous futures. Nutrition, relationships, environments in the first 1,000 days has such a profound impact on the foundations of a child's lifelong health. Poor nutrition in the first 1,000 days can cause irreversible damage to a child's growing brain, and it can also set the stage for later on diabetes, other chronic diseases, which can lead to life-threatening problems. Studies show that countries that fail to invest in the well-being of women and children in the first 1,000 days use billions and billions of dollars and rupees because of the lower economic productivity and the higher health costs. Now, the most important thing that we know is that 90% of a child's brain development happens before the age of 5. And therefore, good nutrition during the first 1,000 days provides the building blocks for healthy brain development. Brain development begins before birth. A child's brain begins to grow on very early in pregnancy and at an astonishing speed. At the 4th week of pregnancy, there are estimated 10,000 brain cells, and by the 24th week, it contains millions. The nutrition that a baby gets from its mother is the fuel that drives much of this incredible transformation. Nutrients such as folic acid, iron, zinc, iodine, and fatty acids play a vital role in building the baby's brain during pregnancy. And when one or more of these is absent, the baby could be at a risk for developmental delays, birth defects, cognitive deficits, etc. And because a mother's diet and her nutrients are the only source of nutrition for a developing baby, it is very, very important that the woman gets the health care and nutritious food that they need during pregnancy. When it comes to brain development, breast milk is nature's superfood. Breast milk is the perfect nutrition for brain development. It contains all the vital nutrients, proteins, as well as growth factors and hormones, and that cannot be replicated in infant formula. These are vital to the baby's brain development, and studies have shown that babies who are breastfed perform better. They're more intelligent, they have higher IQ scores, and also because it involves a greater bonding, mother-to-child touch and nurturing interaction, breastfeeding also plays a great role in strengthening the baby's sensory and emotionally circuitry, which are critical for cognitive and socio-emotional development. Now, during pregnancy, the healthy future starts here. A woman's diet, the rate at which she puts on weight, her physical, mental well-being, her environment, lifestyles have a powerful effect on the child's future. These factors influence how a child's metabolism, immunity, and organ function begin to develop. And if the baby is born prematurely or at a low birth weight, the outcomes have a lasting impact on a child's adulthood. And a growing body of research suggests that diseases such as pregnancy-induced hypertension, strokes, etc., have their origins in pregnancy prenatal nutrition. And most women become susceptible to these and other illnesses later because of poor nutrition. And also there's research that show that babies start to develop preferences in the womb with implications to lifelong eating. So if the mother's starving herself, the baby will also not have a good chance that life will be in starvation mode itself. Now, to build a fair start, the first 1,000 days are a window of opportunity. A healthy baby starts with a healthy mother. And research suggests that inequalities in child development often begin before a child is even conceived. Poverty and food insecurity during pregnancy not only harms the mother, but also the baby and the other children in the house. Even at low levels, food insecurity has long-lasting impacts on developing children and compounds the effect of other risk factors associated with poverty, such as reduced access to good antenatal care, unstable or unsafe housing. Even the stress associated with these conditions negatively impacts development. Studies show that exposure to elevated levels of stress hormones in utero can lead to a long-term negative outcome for child as cognitive delays, attention disorders, trouble in school, and emotional problems. Breastfeeding provides an unparalleled brain building benefit and gives the babies the healthiest start to life. Always encourage breastfeeding, because why give the baby the second best in the form of formula when you can give the best? So therefore, mothers should be supported when they start breastfeeding and to continue breastfeeding for as long as they want to. Low income, we have found that low income women in particular face barriers to breastfeeding because they don't have paid leave, cultural perceptions, attitudes related to breastfeeding, whereas more affluent women tend to breastfeed their babies for much longer time. So let us see the global picture and what is the burden of nutrition on future generations. Throughout the world, millions of young children and mothers are struggling to get healthcare and the support they need to thrive. Globally, an estimated 149 million children under age 5 are developmentally stunted as a result of poor malnutrition in the first 1,000 days, and with another 49 million suffering the ravages of acute malnutrition, making them susceptible to life-threatening diseases and infection. It is estimated that malnutrition kills approximately 3.1 million children under the age of 5 years. And another form of malnutrition we know is obesity, increasingly affecting young children the world over because of unhealthy diets. Even the poor children, because they don't have access to good, nutritious diets, have unhealthy trans fat and easily available packaged food, which then encourages childhood obesities. They are not only statistics, they represent lives in every corner of the globe and every stage of the human and economical potential. This global crisis requires action and investment in the nutrition and well-being of women in the first 1,000 days, with a focus on the most disadvantaged. In 2015, the nation of the world adopted the Sustainable Development Goals, a universal program and progress that endeavors to leave no one behind and set out a goal to end hunger and malnutrition by the year 2030. Doing so in the next decade requires greater political will, urgent scale up by the global world, and global proven solutions that can ensure a healthy and more equitable future for the next generation. What are the solutions? The solutions are nourish strong beginnings for mothers. In the first 1,000 days, a mother's health impacts that of her child. Support mothers to breastfeed. Breastfeeding has the potential to save the lives of 820,000 children and 20,000 women worldwide every year. Improve babies and toddlers' diets. Expand programs that help the most vulnerable. Remember that poverty is the key driver of malnutrition as poor families struggle to access nutrition and health services. And of course, the building blocks for nutrition during the first 1,000 days are nutritious diet for the mother during pregnancy, good care, antenatal care for all mothers during pregnancy, exclusive breastfeeding for the next 6 months, nurturing responsive care and feeding of babies and toddlers, the right foods introduced to babies at the right time, a healthy and nutritious diet for babies and toddlers, paid time off for working parents to care for their newborns, the right knowledge and skills for parents and caregivers to properly nourish young children, because there are lots of myths and misconceptions where the wrong foods are given and the parents think they are good foods which really don't nourish the baby, and a consistent access to enough nutritious food and for families and young children, and societal investments in the well-being of every baby and toddler. Now, breastfeeding we know is a complete natural way of feeding the baby. It provides the ideal food for the first 6 months, and everyone AAP and the world, all the pediatricians encourage breastfeeding at least till 12 months and longer if both the mother and baby are willing. The hormones, of course, are estrogen, which growths, which promotes the growth of breast tissue during pregnancy. Prolactin stimulates the development of alveola and thereby milk. Oxytocin causes the alveola to contract and squeezes the milk out into the duct. And cortisol helps in production of prolactin in the hypothalamus. We all know the benefits, but I'll quickly go through them. Superior nutrition, adequate water, protects against infections and allergies, and promotes bonding and development. So for the baby, the breastfeeding benefits are preventing diarrhea, most important, ear infections, pneumonia, and asthma, cuts the risk of sudden infant death, lowers the risk for obesity and developing allergies. And for the mother, it lessens the risk of breast cancer, ovarian cancer, prevents postpartum depression and type 2 diabetes, and reduces stress. Now, breastfeeding is beneficial for both the mother and baby, as we have seen. External nutrition supplied to the mother is very important in the lactation period, and that in turn will help in the nutrition status. Of course, we know that the breast milk is the perfect food, easily digestible, and then would be a top milk. And the summary of the differences, as we all know, is the human milk has the protein in the right amount, easily to digest, enough of essential fatty acids lipase to digest, enough of water, and good anti-infective properties, which you won't get from animal milk and infant formula. Formula for 3-day-old babies is no different than the formula for 3-month-old infants. And breast milk is ingeniously different every single day, adapting to the changing needs of the baby. Human milk is designed to support the development of various human systems and also the development of a number of neuromotor and cognitive functions. And most of the infant feed formulas contain cow's milk. Cow's milk is designed by the cow to support functions like constant grazing. Now, why are there barriers to bonding? A bottle places a physical barrier between mom and baby. There's less skin contact, there's less eye contact, and the hormonal connection between breastfeeding mother cannot be experienced with a formula-fed infant and their mother. In fact, we always practice the breast crawl. As soon as the baby is born, put the baby on the mother's breast, and the baby actually crawls towards the mother's nipple. It's a wonderful feeling. Breastfeeding rates in India are 55% exclusive breastfed, and breastfed within an hour after birth is only 41%, and 35% of children under 5 are stunted in India. Now, why are there reasons for lack of breastfeeding? Could be stress, the hormones, PCOS, birth control pills, sucking difficulties, and inadequate support of the caregiver, no feeding at night, hidden fertility problems, and most important, lifestyle, insufficient training, stress, and poverty. The complications which arise due to lack of breastfeeding or lack of nutrients in the breast milk could be leukemia, infectious morbidity, risks of childhood obesity, type 1 and type 2 diabetes, and sudden infant death syndrome. So therefore, all the studies have shown that breastfeeding may, in addition to the well-known passive protection against infection, have a unique capacity to stimulate the immune system of the offspring, possibly with several long-term positive effects. Lack of breastfeeding and less intensive patterns of breastfeeding are associated with increased risk of otitis media and the most common infections of childhood. And studies have shown that the beneficial effects of breastfeeding in preventing morbidity and mortality from diarrhea in infants. Now, during the lactation period, many women do not meet the dietary recommendations required. And that is very important because lactation during pregnancy, nutrition during lactation is paramount. There should be adequate nutrition because the mother's producing breast milk, she needs more calories, she needs extra nutrition to meet the needs of the rapidly growing infant, and in addition to her baby's needs, also for her own needs. And inadequate mother's diet influences both the quality and the quantity of the mother's milk secreted. Nutrient deficiency can lead to lower level of nutrients in the mother's milk and therefore would not be the ideal food. Now let us see during pregnancy, how do we take care of our mothers during pregnancy? It starts with the pre-pregnant stage and pre-pregnant counseling. During pregnancy, of course, in all the trimesters, there should be good, adequate antenatal care. The mother should be warned not to have caffeine, alcohol, and smoking, and had adequate rest. Go for a regular antenatal checkup, have a very good nutritious diet. You don't have to eat to two, but you have to watch what you're eating with good protein and less fats and carbohydrates. Have immunization on time. Do your prenatal yoga and exercises, and drink at least 6 to 8 glasses of water. The micronutrients for COVID-19 pregnancy in particular now, because all of us have pregnant women in the past 1.5 to 2 years. And micronutrients, we know, are the key factors in maintaining a healthy immune response and are therefore widely used as supplements for protection from bacterial and viral infections. Zinc is involved in cell proliferation, differentiation of RNA, and the synthesis, as well as cell structures and cell membrane stabilization. Vitamin D has an anti-infective, anti-inflammatory, immunomodulant function. It contributes to the physical vitamin D, and it enhances the activity of innate immune response through macrophages and monocytes and T cells. Vitamin B12 is a water-soluble vitamin. It is a cofactor in the synthesis and is known to inhibit viral replication in the host cells. Vitamin A shows significant reduction in morbidity and mortality in different infectious diseases such as diarrheal disease, measles-related pneumonia, and human and HIV infection. Vitamin C administration to the patient enhances the functions of immune cells. It enhances the absorption of iron. It ameliorates the severity of respiratory infection, pulmonary tuberculosis, pneumonia, and coronavirus infections. Vitamin E supplementation enhances resistance against infections and lowers the viral titer of influenza. Iron may reduce the risk and severity of respiratory infections. Selenium intake has known to enhance immune competent resistance against influenza infections, both in human studies and models. Omega-3 fatty acids, we all know, is brain food. It can influence antigen presenting T cell and B cell function. They are clearly demonstrated to be anti-inflammatory and to be converted to specialized pro-resolving mediators such as resolvins, protectants, and medicines. The need for nutrition in pregnancy, we have already gone through. That this is the most nutritionally demanding period. There's a close association between the fetus and mother because the fetus is totally dependent on the mother's circulation. If mother stores and inadequate, the fetal will develop poorly. Malnourished mothers are more likely to have infants who become ill and have birth defects. Malnutrition in the prenatal period prior to both postnatal period after birth periods also affect learning and disability and behavior. And optimal nutrition intake during pregnancy is the first step towards the child's positive start to life. Now, the need for micronutrients are different in different stages of pregnancy. So you have the periconception epigenetic effects of B6, B12, folic acid. Implantation is aided by vitamin B12, D, E, folate, copper, iron, selenium, and zinc. In the placental function, vascularization and hormone production of the placenta is aided by vitamins C, D, E, folate, copper, ferrous, iron, selenium, zinc. And adequate nutrient transfer regulation from the mother to the fetus is regulated by and enhanced by folic acid, iron, and zinc. Now, in the offspring, morphogenesis, that is organogenesis, which occurs right from birth right up to the 12th to the 14th week, is aided. As you can see, blastogenesis is up to 2 weeks, 2 to 6 weeks, embryogenesis right up to the 14th week, the 12th week, and then fetal development from the 14th week onwards. In vitamin A, E, folic acid, copper, iron, and zinc are implicated in organogenesis and neurological development. B12, D, folic acid, copper, iron, and B12 and folic acid also help. So the adverse health outcomes of gestational micronutrient deficiency in the short term may result in miscarriage, stillbirths, birth defects, small size for gestational age, preterm birth, and in the long term, death, altered growth, body composition, compromised cardiometabolic pulmonary and functions, and poor neurodevelopment and cognition. Iron. Now, what are all the micronutrients? We'll go through quickly. Iron deficiency anemia can lead to increased maternal and fetal mortality and morbidity. We all know that. The prevalence of iron deficiency in pregnant Indian women is the highest in the world, and an oral supplementation of about 50 milligrams of elemental iron per day are effective with less side effects compared to higher doses. Iron deficiency increases the risk of pregnancy-induced hypertension in iron deficient women. Iron deficiency also causes low birth weight and preterm delivery and is the essential nutrient for the developing fetus, neonate, infant, and child. Iron requirements are high during the early stages of life because it is critically important for the production of new red blood cells, muscle cells, as well as brain development. Folic acid, as we all know, is the prenatal vitamin, is the vitamin during pregnancy. The deficiency leads to pregnancy complications such as congenital birth, heart disease, preeclampsia, intrauterine growth restriction, recurrent pregnancy loss, placental abruption, preterm labor, and multiple pregnancy has been reported. Multivitamins containing folic acid during pregnancy significantly lower preeclampsia and gestational hypertension. And folic acid supplementation have beneficial effects on the neurodevelopment of children beyond, and it's a proven effect on neural defects, which is why we give folic acid even prenatally. The longer the duration of folic acid supplementation during pregnancy has beneficial effects on birth outcomes in women with gestational diabetes mellitus. Higher folic acid supplementation was associated with 10% lower preterm risk birth by this study by Neuro. And maternal folic acid supplementation is one of the most popular nutritional interventions during pregnancy for its protective effect against neural tube defects. Now, zinc. Zinc supplementation throughout pregnancy limits neurodevelopmental deficits in the fetus induced by infections. Zinc supplements can be useful in pregnancy complications during especially hypertensive disorders of pregnancy, infant birth weight, spontaneous preterm birth, gestational diabetes. And zinc supplement is prudent for women with poor GI function with any of these conditions during pregnancy. Magnesium supplementation can prevent pregnancy-induced hypertension, has a positive effect on the height and maturity of the fetuses. Magnesium supplementation may reduce fetal growth restriction and preeclampsia, as well as increased birth weight. The use of this drug for the treatment of preterm labor originated in the observation that it caused a decrease in frequency and intensity of contractions in preeclamptic women in labor. And that's why we've been giving Maxell over the years. Iodine, of course, the consequences of severe iodine deficiency include spontaneous abortions, stillbirths, congenital anomalies, endemic cretinism. Increased evidence suggests that even transient mild iodine deficiency has subtle negative impacts, including reductions in IQ, educational outcomes, and language skills. There are certain areas in India where there is endemic iron deficiency, and therefore maternal iodine nutrition supplementation is necessary to reduce the risk of neurocognitive damage to the fetus. The role of iodine-containing multivitamins' effect on neurophysiological development during pregnancy was quoted by BMG Open in their journal. And iodine is plays a critical role in fetal growth and development. Selenium is optimal in optimal concentrations in the body are stimulation and support of female fertility as well as good development of the fetus. Hypersensitive pathologies that occur in 1 of 10 pregnant women, especially during the second part of the gestation period, are largely due to selenium deficiency. And a reduced body selenium and antioxidant enzyme activity during pregnancy results in oxidative stress, with tissues contributing to premature birth, miscarriage, preeclampsia, and intrauterine growth retardation. Now, of course, the all-important vitamin D3. We know that there is in India a dual deficiency, vitamin D3 and B12. And some studies link vitamin D deficiency to a higher risk of pregnancy complications such as gestational diabetes, preeclampsia, preterm birth, and low birth weight. Vitamin D supplementation during pregnancy is suggested to safely improve pregnancy and infant outcomes. 25 hydroxy vitamin D insufficiency is very common in pregnant women and is associated with insulin resistance and is a risk factor for GDM. And prenatal to postpartum vitamin D supplementation is an effective intervention to increase a mother's vitamin D status and to promote optimal vitamin D status in newborns and exclusively breastfed infants. Vitamin B, the case reports on obstetric gynec volume 19 emphasizes the importance of screening for B12 deficiency in pregnancy, especially in at-risk women with unexplained anemia or thrombocytopenia. Lowering the homocysteine levels during pregnancy can ensure a favorable pregnancy outcome, which can be achieved by administration of combination of vitamins like folic acid, vitamin B12, and B6. And pyridoxine supplementation on fetus and neonates positively influences fetal and neonatal outcomes. Vitamin C supplementation during pregnancy definitely helps in absorption of iron. It is said to help pelvic organ prolapse and SUI. This is one study. Vitamin C aids in iron absorption and competes for the placental receptor with glucose. And supplementation with vitamin C alone can reduce risk of preterm premature rupture of membranes and term premature rupture of membranes. Vitamin K deficiency can present a serious health risk to the pregnant women and their babies and may lead to hemorrhage, especially in newborns. Vitamin K supplementation during pregnancy is crucial to improve maternal and neonatal outcomes. Copper. Trace elements, including copper, are components of numerous regulatory enzymes and hormones which are essential to the division and differentiation of the fetal cells and their further development. Copper deficiency may lead to pancytopenia and occurrence of hypodermic anemia, which does not respond to the administration of iron, loss of appetite, damage to internal organs, bone deformities, reduced reproductive capacity, myocardial fibrosis, and chronic debilitating diarrhea. Copper deficiency may lead to neurological disorders and hair depigmentation. Insufficient amount of this element can lead to a reduction in the tensile strength of the fetal membrane and thus resulting in its interruption and premature birth. Now, omega-3 fatty acids, we all know, is vitally important during pregnancy. They are critical building blocks of the fetal brain and retina. Omega-3 fatty acids plays a role in determining the length of gestation and in preventing perinatal depression. According to Cochrane review, the increasing long-chain polyunsaturated fatty acid intake during pregnancy, either through supplements in food or in food or supplements, may reduce the incidence of preterm birth for 37 weeks and for 34 weeks, and there may be less chance of having a baby with low birth weight. And omega-3 fatty acids significantly improves depressive symptoms in perinatal women, regardless of pregnancy, pregnant or postpartum, and are well tolerated. Calcium in pregnancy, another important element. We all know calcium supplementation in pregnancy has the potential to reduce adverse gestational outcomes, majorly decreases the risk of developing hypertensive disorders due to pregnancy. Hypertension is associated with a significant number of maternal deaths and considerable risk of preterm delivery and early cause of neonatal and infant mortality. Low calcium during intake may stimulate the PTH secretion, which then increases the intracellular calcium and smooth muscle contractility and causes increase in renin from the kidney, leading to vasoconstriction and retention of sodium and fluid. And these physiological changes lead to the development of preeclampsia and intrauterine growth restriction. Calcium supplementation has shown effectiveness in reducing the incidence of preterm delivery and is an important messenger required within the uterine muscle cells, which result in muscle contraction following administration of oxytocin. Poor pre-pregnancy bone mineral density, low calcium and vitamin D intake during pregnancy, and poor socio-economic status puts pregnant women at increased risk of low bone mass and later on developing osteoporosis. So therefore, the key take-home points for our talk today is good nutrition in the first 1,000 days prepares the child for a better quality of life. Actions to prevent undernutrition and overnutrition and delay in the non-communicable diseases should focus on the first 1,000 days of life. Scale up nutrition actions both at the national and local levels. Promote and support good maternal nutrition before, during, and after pregnancy and lactation. Promote, support, and protect exclusive breastfeeding for the first 6 months, and give appropriate complementary feeding to baby starting at 6 months while continuing to breastfeed to 2 years and beyond. I think we will skip this because nutrients for brain development we've already gone through, and the micronutrients in the neurological development are vitamin B12, folic acid, vitamin D, copper, zinc, iron, iodine. Folate, of course, we have already talked about, and folic acid supplementation has reduced the incidence of NTD. All those neurotube defects we used to see so many in the beginnings of our career, now we hardly see because of good education and folic acid supplementation in the pre-pregnant and during pregnancy days. Maternal vitamin D status has been related to a risk-attention hyper ADHD in children, and also results in morphologically different brain size of offspring, and has a role in brain size, ventricle size, cell proliferation, and growth factor. Copper, I think we've already gone through. Zinc, we have gone through. Vitamin B12, we've gone through. Iron, and the need for nutrients for skeletal development, calcium, magnesium, vitamin D, zinc, and copper. And therefore, these, my friends, are all the nutrients, supplements that one can prescribe and ensure that the patient gets in the first 1,000 days, which makes a difference for the rest of their lives. Thank you.
Dr. Kiran, for this wonderful session and highlighting the importance of the first 1,000 days and taking us through the concept of antenatal care and the different nutrients which are important for this tenure. So now I would like to welcome and invite another eminent speaker, Dr. Ravindra Chittal. Dr. Ravindra, the dice is all yours.
Thank you, Sheetal, and for the wonderful introduction to me in the beginning of the session. And of course, Kiran has given such an exclusive talk about very well-researched topic about perinatal nutrition and impact on the pregnancy as well as children. And it just really happens to me that my duty will just to underline what she has already said so much. Let me just share the screen for you. Talk of the impact of perinatal nutrition on neurodevelopment and skeletal growth in children. Children are different from adults in that they grow and they develop. Adults only grow up or grow down. They go fat or they go thin. Children keep on growing in stature, in height and weight, and also they develop. So there are two hallmarks of children, and that starts right in the infancy and even before that in the fetal age. So it's very, very important to take care of the babies right in the fetus and infancy and there on onwards. The impact of adequacy of management of a pregnancy and an infancy makes a long-term impact as well as successful adult life as well. To have a flourishing plant, we need a healthy seed and a favorable soil. So well illustrated in this spot here in the soil, growing down in the roots and then growing upwards as we plant one day. The same thing happens to the fetus. The fetus gets its nutrition from the placenta. Placenta draws its nutrition from the mother. Impact of the maternal nutrition will obviously affect the fetal nutrition. World Health Organization has described nurturing care as a part of important taking care of the babies for growth and development. That includes nutrition, responsive care, early learning, health, safety, and security. The main pillars of optimal brain development, which is so very important for a successful life in future. For optimal cognition development, we require adequate nutrition, stimulation, and genetics. Genetic obviously is non-modifiable. Nutrition and stimulation is modifiable and probably in our control in a positive or a negative way. Genes provide the blueprint for the brain development, and the environment shapes it. We do it in a positive way or a negative way. The nutrition feeds the brain, the stimulation sparks the neural connections. For fetal life to childhood, the first 1,000 days, maternal, infant, and nutrition. What are these 1,000 days? Obviously, the 270 days or 9 months of pregnancy, 365 into 2, that is 670 days for the first 2 years, making total 1,000 days. Why is it so important to have first 1,000 days? It's so very important. The 1,000 days between a woman's pregnancy and a child's second birthday sets the foundation for all the days that follow. This is a period of very rapid growth and physical as well as neurological. Intrauterine growth or fetal growth, the normal full-term baby weighs around 3 kilos in the African class, or 2.5 to 2.8 kilos in an average class. That's a national average. The length being 50 centimeters. It starts from a small fetus who measures about 0.1 millimeter, growing to a 50 centimeters in length at term. This 25,000 times since conception. And this continues further. Postnatally, from 0 to 3 months, baby roughly weighs about 30 grams a day, putting on 750 grams in the first 3 months. Each month for the first 3 months, doubles the birth weight by 5 months, triples the birth weight by 1 year, 4 times the birth weight by 2 years. So this kind of a weight gain, which happens in the first 2 years postnatally, is an important part of growth, which cannot be matched later on. Looking at the height, the baby measures about 50 centimeters at birth, 60 centimeters at 3 months, 66 at 6 months, 75 at 1 year, 87 at 2 years, 100 at 4 years. Now this growth, 100 at 4 years onwards, depends upon, of course, a lot of hormonal and nutritional. But the first 2 years, the growth is essentially depends upon the weight gain. Weight that so adequate nutrition is a very important cause of increasing the height in the first 2 years. Predicted adult height is roughly double the child's height at 2 years. So 50% of the total adult growth happens in the first 2 years. So it's so very important that the first 1,000 days of the baby's intrauterine and extrauterine life is so very important for weight as well as height. Looking at the head circumference, 34 centimeters at birth, 40 at 6 months, 44 at 1 year, 48 to 52 at 2 years. And what is the adult head circumference? 60 to 62.5. Meaning thereby 80% of the head circumference, meaning thereby brain growth happens in the first 2 years. So looking at these 3 criteria, weight, height, and head circumference, this becomes so very important to know. Why is it that so important to have adequate nutrition in the first 1,000 days of the baby's life? This is the square indicating the first 1,000 days, the first 2 years, and the entire life. Within 4 to 6 weeks of the baby's conception, we begin conceive that the neuronal development, neuronal tube formation, leading further by neuronal proliferation, neuronal migration. Initially, that is a tangential migration, that is a centrifugal migration, and then a tangential migration, leading to complete form of the neural brain. This is followed by myelination and synaptogenesis, and the brain grows.
Excuse me, doctor.
Yes.
Some background noise is coming from behind.
On my side?
Yes, sir.
Oh, some knocking sound?
There's some locking sound.
There's something outside my building. I'm sorry. I can't control that. I'm sorry.
Okay, sir. Correct. Okay.
So neurodevelopment is partly genetic and partly environmental. The intrauterine period and 2 years of post-uterine life is critical for the first optimum brain development, maturation, and growth. Neuronal formation within the first 4 to 6, first 1.5 months after conception, and then there's a growth, and then finally maturation. The preschool age, which is 1 to 5 years of age, is a time of a rapid and dramatic post-natal brain development. Genetic component, which is beyond our control, is basically for modulating the synaptic signal transmission. The environment controls the neural configuration, incorporating the ongoing experiences of the developing synaptic architecture of the brain. This ability of the neural nervous system to alter the recognizing of the structure, to altering the reorganization of the structure, function, and connection is called neuronal plasticity. Brain is extremely plastic. It responds to the environment. This environment may be intrauterine or extrauterine. Predominantly in the first year, it is an intrauterine environment, which is adequacy of nutrition, maternal diseases, and maternal anxiety, neurological problems. This happens through overproduction, that is blooming or trimming or pruning. What is this overproduction or pruning? As a part of normal neuronal development, there's a rapid synaptogenesis, increase in the number of synapses. At 8 weeks of gestation, the first trimester, there are hardly any synapses, which increases rapidly. And by the end of 2 years, there's almost like a thick bush formation. This reduces by act of synapse pruning, as there's more sophistication of function achievement, that is little pruning. So this synapses blooming is responsible for rapid increase in the brain weight. Brain weighs about 100 grams in the last trimester. At the end of 2 years, increases by 11 times from 1100 grams, 15 times, 1500 grams for the age of 18 years. So majority of the growth of the brain happens in the first 2 years. This increase by synaptogenesis and myelination happens with the deposition of a chemical called DHA. The polyunsaturated fatty acid of the told about, the docosahexaenoic acid, DHA, is deposited in the brain. When the brain is 100 grams, the amount of DHA is about 90 milligrams. By the time the child is 2 years of age, brain weight being 1100 grams, that is 3300 milligrams. 40 times increase in the amount of DHA. And in an adult brain, which is 1500 grams, is 1.5 kilos in weight, that's about 5000 milligrams of DHA. This DHA is responsible for rapid increase in the brain weight. And this DHA is responsible for a multitude of neurological functions that baby achieves in utero and ex utero. The environmental factors, nutrition, maternal and fetal diseases, socioeconomic status, emotional state of the mother, and positive influences. Nutrients are macronutrients and micronutrients. So much in detail of here I'll explain to you. The important macronutrients are proteins, carbohydrates, and fats. But these fats are not energy-giving fats that we know about. These fats are basically polyunsaturated fatty acid, which becomes a part of phospholipids. Phospholipids are membranes of the neurons, membranes of the oligodendrites, and that is responsible for myelination. Micronutrients like iron, iodine, zinc, selenium, choline, copper, and vitamin A, as well as calcium and magnesium. Maternal diseases like hypothyroidism, epilepsy, maternal hypoxia for any reason, maternal stroke leading to ischemia, or fetal hypoxia, fetal ischemia, all contribute in a negative way and affecting the neurological function of the baby. Socioeconomic state affecting the nutrition in qualitative as well as quantitative. Many times a qualitative deficiency gets compensated by increasing more of the food, and that's why sometimes having junk food, more fat and carbohydrate oriented food will lead to malnutrition. So you have malnutrition 2 times, qualitative and quantitative. Food insecurity because of poverty, because of increased number of children, because of increased number of liabilities financially, it causes a sense of food insecurity. Also, with poverty goes communicable diseases, vaccine preventable and vaccine non-preventable communicable diseases, which also adds to the burden of the family. Absence or presence of opportunities and increasing stress also adds a negative way to the baby's neurological development. Emotional state during pregnancy, emotional state during the formative ages of the child, as well as motivation from the parents, alcoholic father, working mother, lack of motivation to the child's development adds a negative way to the baby's brain development. Positive influences could be impact of toys, impact of school, in a positive way, the baby's brain development. What you eat, I'll tell you what you are. What you eat all goes to the brain. It has to be multicolored diet. It has to be positively in a high protein, moderate carbohydrate, low fat diet, and a lot of antioxidants. We mostly have carbs and fats in a diet, which gets deposited in the midriff, causing truncal adiposity, causing insulin resistance, causing obesity later on. So deprivation of nutrition during pregnancy, compensating by high carbohydrate diet, can lead to an IUGR baby to begin with, who leads to obesity much later on when they have access to food. This is the Barker's hypothesis, and which has been seen during times of famine during pregnancy. The nutritional deprivation that the fetus suffers from leads to obesity much later, type 2 diabetes, and hypertension. The food has to be multicolored because colored fruits have a lot of antioxidants. We mostly have apple and banana, which is staple food of most of the people. Now, apple and banana, when you cut open and keep it, it becomes brown. It gets oxidized. It has no ability to fight the oxidative effect. The oxygen becomes brown. Now, oxygen is good for us, but remember, oxygen also burns as we get age. We all get old because of oxygen burns us down like a candle. The candle glows because of oxygen, but candle also burns down because of oxygen. Now, this is the oxidative radicals which makes us grow old with time. To fight this oxidative radical effect, we need to have antioxidants. Colored fruits are rich in antioxidants. All the berries are rich in antioxidants. Our ancestors who live in Himalaya, they used to climb 1,000 feet, 10,000 feet, thick fellows, live 100 years. They used to have small berries called karwa, blackberries. And these blackberries are loaded with antioxidants. So one needs to have a lot of antioxidants during pregnancy, have green tea during pregnancy, and post-baby. Now, this is good food hygiene, good food habits, which leads to a healthy lifestyle later on. American Academy of Pediatrics, the Committee of Nutrition, has highlighted the importance of macronutrients and micronutrients during the critical and sensitive brain development. The critical phase development are obviously intrauterine, as in the first 2 years of life, and sensitive period comes much longer than the age of 5 years. The macronutrients in proteins, especially the branched chain amino acids, they are very important for brain development. Specific fats like long-chain polyunsaturated fatty acids, omega-3, the DHA, omega-6, which is ARA, and of course phospholipids. And of course, we have glucose. Excess glucose gets deposited in the infant of a diabetic mother, but a mother is hypoglycemic, mother is malnourished. Glucose is an important fuel for allowing the baby to grow. We will be IUGR. Micronutrients, Dr. Kiran has so very lucidly said about the importance of zinc, copper, iodine. Iodine is an important element and works through thyroid development. That's why hypothyroid mother can lead to immense, irreplaceable, irreversible damage to the brain. That's why iron deficiency can lead to subclinical hypothyroidism in the mother and lead to brain damage in the baby. Iron is an important catalyst for many of the enzymes in the brain and in general all the organs. So iron deficiency leads to IUGR, iron deficiency leads to mental retardation, iron deficiency leads to enzyme deficiencies in many of the tissues. Selenium, vitamin are basically most of the B complexes are cofactors in many enzymatic activities, especially B6 and B12. Folic acid is very important for neurodevelopmental defect prevention. And antenatally, and the first 8 to 12 weeks of pregnancy, folic acid has drastically reduced the incidence of neurodevelopmental defect in infants. Choline is a factor which is a carrier protein for carrying the lipids. And lipids are essential part of the cell walls of all the tissues, especially the brain. And choline becomes an important factor to carry this to different cells. Impact of nutrition on neurodevelopment. Intrauterine period, infancy and early childhood represent a period with both exquisite opportunity as well as vulnerability for neurodevelopment with respect to nutrition. Nutrient requirements are high due to rapid physical growth and maturation. 60% of the nutrition in infants versus only 20% is required in adults. Different parts of the brain grow at different rate. For example, cortex, cerebellum, striatum, and hippocampus grow at a different rate than the prefrontal cortex. And different processes like myelination, synaptogenesis, neurotransmitter reuptake develop at a different time frames and different trajectories of onset, peak, and cessation. So deficiency of these elements, macros and micronutrients, at different time can affect during the critical phase or a sensitive phase. They are sensitive to adequate nutrient supply and vulnerability to deficiency of nutrients in different specific times. Optimum maternal nutrition in pregnancy ensures normal neurogenesis, neuronal proliferation, neuronal migration, myelination, and neurotransmitter-related processes. Specific nutrients like choline, folic acid, iron, zinc, vitamin A, special fats like gangliosides, sphingolipids, and glucosohexaenoic acid or DHA, which is omega-3, has special beneficial effect on neurogenesis, synaptogenesis, and myelination. So very important. What makes us the Homo sapiens? We are different from all the other animals on this planet because we have an ability to incorporate DHA in our brain, and that makes us so different. That makes us so different from all the other 100,000 animals on this planet. And DHA is important to be deposited in the brain during pregnancy in the first years of life. Now, a very, very elegant study done. Of course, I'm not racist, but this was a study which was done in Tamil Nadu, where two groups of pregnant women. One group of pregnant women during the second trimester, from 3 to 6 months, were asked to consume fish. The second group of mothers was not allowed to consume fish. After 6 months, the first group was asked to discontinue having fish. And fish contains a lot of DHA. So they followed the pregnancies. Those who had fish in the 3rd to 6th month had babies which went to full term, which Dr. Kiran has already highlighted. They had bigger weights at birth. They had a bigger head circumference at birth. Their IQ at 2 years and puzzle solving ability at 5 years was more superior than the other group who did not have fish. That's the kind of importance of DHA. Now, DHA is important not only during pregnancy, DHA is important postnatally, and breast milk is an excellent source of DHA. Now, maternal diet does matter in the amount of DHA that the breast milk can contain, but the point is breast milk has a more available DHA than the actual quantity. And so continuing breast milk till the age of 2 years ensures baby has an adequate supply of very, very important nutrition, which is DHA, which is important for development of brain and development of eyes and retina. Have a special beneficial effect on neurogenesis, synaptogenesis, and myelination. Optimum nutrition has also beneficial effect on through growth factors like retinoic acid, vitamin E, and facilitating gene expression in the brain. That's called epigenetic. This not only affects the baby, it affects the next generation, and that is called epigenetic effect. During the intrauterine period, the vulnerable to deficiency of glucose, protein, oxygen, iron, zinc, selenium is immediate, and iodine deficiency is immediate to thyroid. Deficiency of folic acid is very sensitive between 21 to 28 days. In the postnatal period, breast milk ensures adequacy of all the macronutrients. Micronutrients are related to maternal status, are vitamin B6, B12, choline, and iodine, and selenium. So inadequate B6, B12, and iodine and selenium in the mother can lead to deficiency. If the maternal supply of the nutrients are adequate during pregnancy, during lactation, baby will not have a deficiency. On the other hand, till the age of 6 months, iron, zinc, and folic acid, and iodine, and polyunsaturated fatty acids are unrelated to the maternal levels. The mother might have deficiency, but baby will be getting adequate supply at the cost of the mother. So you need to enrich the mother with iron, zinc, folic acid, and PUFAs so that she does not get deprived of this important nutrition. Continued deficiency in the mother beyond 6 months, however, leads to deficiency in the baby as well. Exclusive breastfeeding will lead to deficiency of most of the macro and micronutrients except iodine and PUFA. Now, how do these work? These branch and amino acids are important in the hippocampus and the cortex. Deficiency leads to global delay and altered social behavior. Iron deficiency, deficiency in myelination, monoamine neurotransmitter synthesis, hippocampal energy metabolism causes delay in the speed of processing, delayed motor milestones, dull and irritable, and poor memory. Zinc deficiency is important for autonomic nervous system regulation, hippocampus, and cell development. Long-chain polyunsaturated fatty acid, especially omega-3, which is a DHA. These two is important for synaptogenesis, membrane function, and myelination in cortex and retina. It leads to deficiency of visual acuity, deficiency of intelligence, and problem-solving skill. Iodine deficiency through hypothyroidism causes mental, physical, and probably hearing defect. Vitamin A is important for general immunity and competence of retina with the rod cells and causes night blindness. Choline is important for synthesis of phosphatidylcholine, sphingomyelin, acetylcholine, or choline-related neurotransmitters, an important neurotransmitter of memory, mood, muscle control. Robinson modulating gene expression, cell membrane signaling, lipid transport, metabolism, early brain development. Breastfeeding till 2 years helps in general growth, immunity, global brain development. Deficiency of breastfeeding in the first 2 years is to delay motor, mental, and emotional development. The first 1,000 days, the time spanning roughly between conception and the second birthday, is a unique period of opportunity. One should not miss this when the foundations of optimal health, growth, and neurodevelopment are established. The critical or sensitive period of brain development susceptible to specific nutrition deficiencies are increasingly well defined, making prevention of a long-term deficit as well as well-timed nutrition interventions during the fetal period and first years of life to possibility. Thank you very much. Thank you for your patient hearing.
Thank you, Dr. Ravindra, for this insightful session and helping us understand the importance of the colorful nutrition and highlighting the importance of micro and micronutrients in the brain development. So without any further delay, I would like to welcome Dr. Kiran on the forum so that we can have a healthy panel discussion on this first 1,000 days. So the first discussion point which we have today is we know that despite the known advantages of the human milk in early life, estimates are that 90% of the children receive no human milk in infancy. And moreover, in accordance to this, the American Academy of Pediatrics provides a substantial information on the nutritional needs and support of children from the birth to age 2 years. So, Doctor, we want to understand what is your take on the best nutrition uptake for mother and the baby in this first 1,000 days journey. So, Dr. Kiran.
Yeah, sorry, I just gone to attend to a call.
Okay. Do you want me to repeat the discussion point, ma'am?
Yeah, please.
Okay. So I was just highlighting that in spite of advantages of the human milk, it is estimated that 19% of the children are, deprived of the human milk in infancy, and only 22% of the children are on breastfeed, which is recommended for 6 months. So, and moreover, in accordance to the AAP, which provides us the substantial information of the nutritional needs and support of children from the birth to age of 2 years, we want to understand, doctor, what is your take on this with respect to the best nutritional uptake for mother and the baby in this first 1,000 days journey?
Right. Of course, as we very extensively said in my talk as well as Ravi Chittal's talk, is that breastfeeding is the best. Why give the baby second best when you can breastfeed? But why is there such poor breastfeeding in India? Maybe because a lot of India is, urban poor. And I think it's among the urban poor marginalized women that breastfeeding is at the lowest for various reasons. Number one is that they have large families, they have no privacy in the house, they have to breastfeed properly, they don't have proper nutrition, they have to go back to their work. Many of them are daily wage earners, many of them have jobs where Of course, the government has given, but governments have given 5 months, but private institutions sometimes don't. And small scale industries, etc. All these are the women who are working. They are the ones who cannot afford to breastfeed for a long time because they have to leave their children and go back to work. So it's usually these more poorer strata of this thing, urban poor are the ones. If you see the affluent, almost all of them are well-read. They all know the value of breastfeeding. They get time off from their offices, etc., because they give, the government gives 5 months. They can extend it also as medical leave. So most of my patients are definitely 100% feeding their babies for 6 months. Then, of course, certain situations, like for example, many women have polycystic ovarian syndrome. They already have a hormone imbalance. Many of them are obese. They do not produce enough of milk, or they're not that motivated also. You see, we have a lactation consultant. We should have lactation consultants who will teach proper breastfeeding practices, which is very important. Then if they get a crack on the nipple, or the mother-in-law comes and says, oh, you have no milk, that itself sounds the death knell for breastfeeding. So therefore, good support for breastfeeding is so important even in this strata of a society. And if they've had a cesarean section, or if they're in pain and they don't do that initial breast feeding and let down, etc., then they don't get, or if they give the bottle too early, or they're given the nipple shield and then the baby has nipple confusion. So all these are deterrent to breastfeeding.
I would agree with that actually, because it's more a social problem rather than it's not an endemic, or it's nothing because of our genes or something. We have been good breastfeeders as it is compared to the rest of the world. We have been good breastfeeders in India. But like Dr. Kiran said, the necessities of life, a small place, no privacy, and the need to go back to work again, and plus poor consideration for the mother in the house as a woman, that she needs to rest, she needs to take adequate nutrition herself. I mean, her nutrition gets compromised at the cost of children's nutrition. I mean, for a noble reason, but that's not the way to go about. And giving a lactation leave is, yes, allowed by the government, but in reality, they go back to work pretty early. But surprisingly, I mean, over the time, it is the affluent class which is now more and more inclined to continue breastfeeding, and they're very happy doing it. They in fact store the milk, even if they have to go to work, they do store back the milk, and they are happy continuing breastfeeding. And the bottle feed impact of no bottle feeding has made a big difference, because initially bottles were offered very much in the hospital sometimes, which I can tell you, I mean, with confidence, and very happy that the hospitals where Dr. Kiran and I both did work are baby-friendly hospitals. No bottle feeding allowed. We don't have bottles in the hospital. And we are lactation specialists who come and counsel the mothers to be patient and to give time, take care of the pain. Be proud and happy that you're breastfeeding mother. This kind of confidence which comes from the hospital itself makes them go a long way. And I think we should encourage that. Like mother-in-law, instead of being a kind of a strict woman, she should be more supportive. And I think don't criticize the daughter-in-law who's trying the best of what she can and continue breastfeeding.
Okay, thank you, doctor. So the another discussion point which emerges out of this session today is that many doctors and pediatricians are already anticipate about the neurodevelopmental concerns in children with the early nutrient deficiencies, and we want to know that, doctor, what is your how do you highlight the role of these critical micronutrients in pregnancy's outcome and child health?
Yeah, is that for me?
You go ahead.
Anyone can take it.
Okay, I'll answer that. Well, it's too early in the pregnancy because we hardly have an exposure to the mother in the early part of the pregnancy.
Right.
But gynecologists do impress on them the need to take adequate nutrition. I mean, I'm sure, Dr. Kiran also said, all the gynecologists, the need to take DHA during the mid-pregnancy has been now so important. Folic acid initially, continued calcium through the second trimester onwards, continued DHA, continued iron folic acid, which is important not only for the maternal health, and it's also important for the baby's health. And it continues further because they insist on the mother should take calcium, vitamin D till the mother continues to breastfeed till the age of 6 months for minimum. And this continues in ensuring that the baby gets adequate supply. The need to do check for thyroid. Now, thyroid, pre-pregnancy, many mothers are non-hypothyroid. The stress of pregnancy itself highlights the rise of TSH as a marker for hypothyroidism. And very correctly, the importance of correcting that by not being iodine in the diet, but at least your low dose of thyroxine hormone, which is very important for the baby's neurodevelopment. And that continues. And they know that post-delivery, again, the thyroid status comes to normal. But this ensures that the baby is getting adequate micronutrients and macronutrients. And of course, the macronutrients, the wrong type come post-delivery, because every mother and the grandmother want the mother to become fat, to make the baby fat, which is a myth, which is not so. You can have a fat mother and a thin baby. So mother should be insisted on having high protein, moderate carbohydrate, low fat diet, and an adequate of antioxidants, colored foods, colored vegetables. And that's not turning around. I mean, we get this very educated, informed mothers who insist on doing exactly that. Secondly, they should be insisted not on losing weight. Don't put on weight for sure, but don't try to go on a losing weight spree also, because you have done an immense damage to your body, getting pregnant, going through the pregnancy and delivering. So don't become superwoman immediately. You want to go back to your form that you had before, but gradual weight loss later on, after the body gets prepared. And Dr. Kiran, I'm sure she counsels some others so well, so they are taken good care of.
Right, Ravi. I think the counseling starts in the as you rightly said, pre-pregnant state. In the pre-pregnant state, if we encourage all mothers to come for a prenatal counseling is very important, because at that point of time, we can start them on folic acid. We can do all the investigations to rule out thyroid dysfunction, which is very common now, as you rightly said. Thyroid dysfunction. If they are very obese, allow them to lose weight, treat their PCOS. If they are very thin, then give them good nutritional support and check for vitamin D and other deficiencies, correct their vitamin D, B complex, folate, and give them preconceptional folic acid. So, right, even before they plan to have a pregnancy, all this should be done. Then during pregnancy, as you rightly said, first trimester, of course, they hardly have anything, but second trimester onwards, good nutrition and supplementation is very important. I find in practice that most women, they say, we don't want to take medicines. They feel that it's a medicine. So you just have to explain to them it is the food, and try to give them supplementation also in the form of maybe biscuits and protein supplements and milk, which are, which have added vitamin D and zinc and all these minerals. And then they are more conducive to taking that. Iron, of course, as I said earlier, you have to give it in a smaller dose, because iron causes a lot of GI disturbances, which most women during pregnancy anyway have GI disturbances, very difficult for them to. So iron is the most important. So, there are even superstitions, Ravi, that people say that if we take iron, our children will become dark. So they don't take iron. It happens all the time, and you have to tell them that, you see. And another thing is that they have the iron with their rotis and chapatis, etc. The phytates, there's neither the calcium nor the iron is absorbed. If the iron and calcium is taken together, it doesn't get absorbed. So the best is to give iron at night in between a food with some vitamin C, and that will enhance, or maybe a glass of Mosambi juice or whatever, that will enhance the absorption of iron. So all these are little tips to tell them during pregnancy how to improve their nutrition, and not to have the wrong foods. As you rightly said, in the postnatal period, all the mothers and grandmothers treat the patient as if she's a cow and give them extensive diet. And I always say the diet should be according to the climate. There's no point in giving a large amount of ghee and all these laddus, etc., which are totally indigestible, and it becomes a problem for the woman during her pregnancy as well. As I have had so many patients during their last few weeks of their pregnancy, the mother gives them a whole lot of ghee to lubricate the passage, but they don't know they are lubricating the wrong passage. So as you said, educating everyone on right practices and right nutritional food is so important.
Thank you, Dr. Kiran, for this right message. The another point which comes on to my mind, which you people have already touched superficially, is about the nutrients such as folic acid, iron, zinc, and iodine, as well as protein and fatty acids, plays an important role in the building a baby's brain during pregnancies. So, doctor, I wanted to understand that whether you people must have come across your experience where one or more of these nutrients are absent during pregnancies. So does it has any risk on the baby's development?
I think with regard to that, I had already touched on in my talk about all these various essential acids and fatty acids. And yes, in our practice, we have seen, in my early days of practice, we should see a lot of neural tube defects and spina bifida. I mean, now we hardly see that, because most people are aware of prenatal folic acid and folic acid during pregnancy. Similarly, because of iron, we have so many children who are preterm. You see, if you have anemia, lack of zinc, magnesium, calcium, and all these micronutrients result in greater chances of having pregnancy-induced hypertension, or hypertension itself during pregnancy results in preterm labor, IUGR, etc. So, you know, this supplementation is so important even to have a very good gestational outcome and to prevent the complications. And of course, as Dr. Ravi Chittal rightly pointed out, thyroid deficiency we are seeing a lot. Even if a patient is euthyroid prior to pregnancy, because of the stress of pregnancy, she becomes, she gets hypothyroidism, and that results in a sort of cretinism and low thyroid in the infant as well as neonatal jaundice and developmental defects.
Right. Dr. Ravindra, what is your take on this?
The same thing. I would agree with the same thing. The only thing, folic acid is the main thing, which is a very dramatic difference in what it was maybe 20 years back and now. So I agree with completely.
Thank you, doctor. So we already acknowledged the the importance of breastfeeding during the fetal development in the womb itself, and we wanted to understand, doctor, what are the micronutrients which a mother should normally consume during this pregnancy and lactation? What is advisable?
I think we have gone through all the micronutrients in great detail. It will just be a repetition, you know.
So, moving on to the next question, which emerges is what are the benefits of the supplementation of the combination of calcium and phosphorus in children? So, Dr. Ravindra.
Yes. Calcium and phosphorus is very important for bone formation. And what we need, of course, to get adequate supply of vitamin D, because vitamin D helps in absorption of phosphorus, and secondly, the calcium. Now, many of the calcium preparations have calcium carbonate. Now, calcium carbonate is an insoluble salt. It only gets deposited in the intestine, does not get absorbed, and can cause constipation in the child. What we need to have calcium and phosphorus in the ratio of 2:1. 2 of calcium, 1 to phosphorus. And that is very, very important, especially from the 3 months onwards. Baby must have a calcium phosphorus 2:1 ratio, and that helps healthy bone formation. But calcium and phosphorus, this makes the preparation a little thick. That's why in the early infancy, it may not be possible to give calcium and phosphorus, but we can give calcium glucobionate, lactobionate. And post 3 months, because whatever calcium the mother has transferred to the baby in the last 3 months of pregnancy, provided she is calcium. That means if the mother has taken adequate calcium and vitamin D, her calcium is adequate. The calcium is accreted into the baby, even against calcium concentration. Even if the mother is calcium deficiency, she continues to transfer calcium to the baby. And that's why unless she is very deficient, the baby continues to have calcium. So in the first 3 months, you don't have to get unless the baby is premature. But post the first 3 months, baby needs to have a calcium phosphorus in the ratio of 2:1, which is important and continues till 2 years.
Right. So, doctor, we have been talking about the importance of the nutrients, macro as well as micro. What is the last, the first 10 building blocks of nutrition which you suggest for this first 1,000 days? Just 5 or 6 nutrients which you feel are at most important for the building of this first 1,000 days.
Yeah, you want me to take it? Yeah.
No, go ahead.
Yeah. So calcium, for all the reasons, calcium not only to replete the mother's stores, but also calcium is very important to prevent preeclampsia, preterm labor, etc. So calcium is very important. Iron is, of course, of paramount importance, as we all know, because most of our women are anemic. Folic acid, of course, for birth defects, and also all the enzymes of the placenta as well as the babies during the growth all require folic acid. And vitamin D3, again, we found a lot of deficiency. Vitamin B1, B6, B12, that's another one. Then, of course, zinc is important. Magnesium is important for all the reasons which I already told you. And then, of course, selenium and copper, iodine supplementation, especially iodine supplementation, iodized salt in areas where there is endemic goiter. And omega-3 fatty acids for brain growth, yeah.
Yes. Dr. Ravindra, would you like to
Right,
highlight?
absolutely, absolutely. This is exhaustive completely. She's covered up everything.
Yeah.
And we have already said that all this because it's so important. And both she and I are so passionate about our clients' good health. So these things are all taken care of. So we don't have to think about it. It's there. It's by default that every mother should take this, and the baby continues to have it postnatally till they get to it's very, very important.
I must tell you, Sheetal, is that Dr. Ravindra and I were together from Vadia days, and he has been taking care of all my babies for the past 35 years.
That's
We're attached to the same hospitals. And he's taken care of my grandchildren also.
That's nice. So, Doctor, thank you for the interactive session which we had. Just one-liner takeaway message which both of you want to give through this platform is what?
Can I say that first?
Yeah.
Yeah. Take care of the mother so that she takes care of the baby well. That's all I would like to say. Don't ignore the mother. She's so important. Take care of the mother and she'll take care of the baby. Thank you.
Dr. Kiran, please.
On similar lines, the old adage, the hand that rocks the cradle rules the world.
Correct.
And if we don't take the care of the hand that rocks the cradle, we will lose the world and the future generations also.
Okay. So both of the doctors, thank you so much. But before we close the session, I'll just take 2 minutes of yours and the other doctor fraternity present over here. I would like to just highlight one important news with respect to Mayor Organics. I'll just share my slide. Please be patient. Okay. Ma'am, are you able to see it?
Very well.
Okay. Ma'am, this is about the, it gives us a pleasure to announce that our director, Miss Uma Kalekar, has been conferred with the prestigious Janani Award in the Nutritional Leadership category, which was given on 20th May 2021. So the award was bestowed on her by the Integrated Health and Wellbeing Council, IHW, for her exemplary contribution in the areas of nutrition and health for women. So we want to congratulate her through this platform, and the award was conferred to her by Shri Ashwini Kumar Chaubey, Minister of State for Health and Family Welfare, Government of India. So it is indeed an honor for us to be receiving this award alongside the other health leaders and champions in women's health. So congratulations, Mrs. Uma Kalekar, for this prestigious award. And I'll just take 2 minutes of yours. We'll just highlight the video through which we have received this award. Manish, can we have the video, please?
Let's now move on to the next set of awards, Nutrition Leadership category.
The award in Nutrition Leadership category goes to Uma Kalekar, Managing Director, Mayor Organics.
Ms. Kalekar has been continuously working towards health issues of birth defects in children, prevention, care and rehabilitation, and the way forward in India. Her efforts in creating awareness about health and nutrition in the country through various initiatives are well applauded across the industry. So, Abhijit, I would request you to please present the award to Kalekar ma'am.
बहुत अच्छा उमा कलेकर जी को बहुत बहुत बधाई। आपने हेल्थ और न्यूट्रिशन पर और रिहेबिलिटेशन पर जो काम किया है उसके लिए आपको बहुत बहुत बधाई है।
धन्यवाद चौबे जी, and I thank Mr. Kamal Narayan also. It is a privilege to be amidst all of you, all the dignitaries here and all the co-awardees. It's really a great honor for me to accept this award on behalf of my organization, Mayor Vitabiotics. So my organization, Mayor Vitabiotics, is committed to women's health for more than 3 decades. We are wellness companion for every woman at every stage of her life. So be it osteoporosis or a pregnancy nutrition or a menopausal health, we are committed with our innovative products. It is really a great honor for us to receive this Janani Award, a very prestigious award from IHW. And I'm sure that this makes us more responsible to work more harder to ensure that we serve all womanhood. And when it comes to the birth defect, the initiatives which you take to ensure for the pregnancy nutrition, I think the best gift any person can think of to a woman is a healthy pregnancy and a healthy child. And we are committed for it. And I'm sure that Mayor Vitabiotics will ensure that every woman will have a good health for herself and for her child. I once again thank all of you for this prestigious award. Thank you very much.
So congratulations to Mrs. Uma Kalekar for her exemplary achievement, and we wish that we achieve more success and we contribute towards women's health through more decades.
Congratulations to all of you.
Thank you so much, ma'am. So we are towards the end of the session, and I would, on the behalf of Mayor Vitabiotics, I would like to thank Dr. Kiran Coelho and Dr. Ravindra Chittal for such an insightful session on this 1,000 days. It was indeed a thought-provoking session from the fetal life to childhood and covering all the nutritional needs in the first 1,000 days tenure. I once again thank all the delegates for attending this session and being an active part of this panel discussion. It was actually a great honor for me to moderate this session. And I also thank Mayor Vitabiotics for arranging a wonderful informative session. I hope it helps all the delegates present over here. Yeah. Thank you so much, doctors.
Thank you. Thank you.